expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. Have I always told you, or have I ever told you, you make my Saturday mornings?
Oh,
you really make my Saturday mornings.
That's so sweet.
I mean,
and
you're
something,
so special.
I look forward in being here with you.
Thank you. I feel the same way. There's a certain spiritual connection here.
Yes.
It's very, and you're always gorgeous. You come here.
Thank you.
I know I'm going to take a picture of this again. Dr. Mencia, how did this? Before we get into the medical stuff, how do you see why you dress so beautifully? I mean, I know why I like men to dress beautifully, but what is it in you that is not in a lot of men?
I love my profession. When I was a young boy, many, many years ago, my father used to say I was going to be a lawyer. So, he would prep me, you got to go to the school, you want to enter the school. And in Hawaii, we don't have that many law schools that are, prominent. Medical school, yeah, and medical residency, like one of the best geriatric residency program, one of the largest one, is in Hawaii. We treat a lot of veterans there and what have you. And but I never thought myself going into medicine. And then as I was going through college, I noticed all of my science classes, I would do so well. And my biologist chairman would go like, you have to be a biologist, you are so good at this. And my chemist chairman doing the same thing. You have to be a chemist. You are good at this. And then I started teaching physics, and I said, wow, I'm really good at science. It just comes so natural to me. So I eventually I studied psychology, became a doctor. And I love it so much. I fell in love so much with the act of practicing the profession. Because you can be an academia doctor where you just teach all the theories, and somebody want to know about when should we treat cholesterol, and they will cite all of this number for you and say, what the research have shown, what is the best treatment, and what have you. And for blood pressure, if you have kidney disease, if you are black, if you are white, if you are male or female, and they have all these statistics on if you are a black person with high blood pressure, this is what we're going to give you. If you are a white person with high blood pressure, this is what we're going to give you because of a statistic. And I didn't fall in love with that part of medicine. I felt more in love with with the background in psychology and my background in holistic approach to healthcare. I fell in love more with the behavioral aspect, the action of being a doctor. So
that's interesting. The action of being a doctor. I've never heard that term.
So, and every day I just look forward to going to work and treat all of my patients with dignity. So I see doctors. Sometimes I go to I teach all over, and I see doctors, the way they dress. And some of them, especially if they live here in Florida, a short sleeve T-shirt or a short sleeve shirt, unbuttoned, no tie. Sometimes you see them with shorts. Sometimes you see them without socks. And I say, well, I'm a geriatrician. And I treat, as an internist, of course, I see a lot of young patients that I treat. And I love treating them. I see, adolescents that I treat. I love treating them. But whatever the age of that patient, when they come to me, I want to be presentable and treat them with the utmost respect when they're there with me. And, when they come on Sunday and they happen, sometimes you get people on Sunday, they knock on the door. And I'm there. I will open the door. I say, oh, doctor, I'm sorry. I didn't know if you were here or no. I just stopped by. I need a prescription. I will go and write a script. And I might be with short and T-shirt and my hair down and say, I've never seen you like this. But I will go ahead and write the script with the same love as when I'm dressed for them. But when I'm there, that I know that my job is to take care of patients, I like to be as presentable as I'm allowed to.
What's interesting, as a woman, I love when men dress as you do. I mean, I really do. And I've had a little problem with my wonderful husband because where he was in business for years and had to dress now, he tends not to. And I will say to him, Bill, if you still want to be author, be respected and all, you need to dress differently.
Of course.
And he listens to me. But his first inkling is not to do that. And I find that with older men. They don't shave every day.
Right.
They let themselves go. Now, sometimes if they don't, because they have macular degeneration, they don't see as well. They don't see spots on their clothing. And so now I have Bill's trained to say, okay, look at my clothing. Tell me if there's anything on it. Because I think if once someone loses respect for themselves,
absolutely,
other people lose respect. And that's, in my capacity as a gerontologist, I've noticed that with women and men, that if they don't keep themselves looking well, then that's why the public says, oh, well, he's just an old person or she's an old person, and they don't respect them.
Yeah, and that's from the social point of view. From the biological and psychological point of view, when a person is able to take good care of themselves, you feel better. If you feel better, your immune system is working at its optimum. So if you feel down, even if you are not depressed, but you behave as if you don't care, you will be more prone to become depressed versus the person that behave as I care about myself. I care about how I looked to other people, and it's always, the first intention is always to please yourself. So when I dress, I want to please myself first. And then when I walk out, I want to be able that I'm there for others. So, and I hear not only from women, from men too. When they come, they say, wow, you look so nice. You dress so nice. I love you. Yesterday I had a beautiful green tie that I love. And I got so many compliments on my green tie. They say, oh, the tie is so beautiful. And can I touch it? Let me feel your tie. And a lady, they say, oh, my husband loves tie. Let me look at what kind of tie is this so I can get that line of the designer. It's really good.
So everybody feels the way I do, I think, when they see you. I mean, you do take a lot of time. Everything matches. You have beautiful clothing. It's really part, I think, of you wear a stethoscope, and it's your clothing stethoscope where it's another part of your medical
even my
paraphernalia.
Watch,
right.
My watch, I match to my clothes.
Right. Your paraphernalia is really your medicine. It's like you
exactly.
probably don't carry
Absolutely.
a little black bag like people used to.
Exactly.
But it's who you are, and we get an impression right now that you care. That's what you're saying, isn't it?
Even with Mother Natasha, when she came to the office and we went privately into the room to talk, and we are sitting there and I just touched her and we are talking and she said, I feel better. I was having that back pain, but somehow I just feel better right now. I said, great.
That's
so
what you
it's
do.
that spiritual connection.
Yes.
We were talking before we went on the air about our immune system. And one of the points that I was bringing up that we should bring out into the community is like, if we ask 1,000 years back, humankind, what they know about their universe, what humankind knew about their universe 1,000 years back, or maybe 200 years back, and you asked humankind today, they know a lot more about the universe. They think, the universe is huge today compared to what we knew about the universe 1,000 years back. It's huge, but it's even bigger than our imagination is telling us today. So the immune system is such a huge universe that we know very little about it, even today. So probably 100, 200 years from now, we're going to know more about the the immune system, our immune system in your body, is a universe all by itself. Just like we see this universe, and now we find out that within this universe, there's another universe that's probably even bigger than the universe we live in. So our mind keeps expanding as our knowledge expands. Our mind keeps expanding, and we become more humble about who we really are.
Okay, I'm going to ask a dumb question. What does the immune system look like?
The immune system looks like our universe. It's made up of, just like the universe is made up of planets and stars. And, the immune system is the same thing. It's made up of chemical and cells and all this, the way this chemical and cell interact with each other. They don't have to be in close proximity to each other. They can be at a distance from each other, but they still are. One is able to stimulate. Certain chemical is able to stimulate other cells to, let's say, if you get exposed to a virus, that virus will come in, certain cell will go by your nose, if you can, through your nose, or through the skin, and they will go and start creating certain chemical that will go over where bones are producing other cells and stimulate the right kind of soldiers to come back and grab those viruses and lock them up and throw them away. And then you have the immune system have won the battle. But sometimes, then humankind, we interfere. Just like when you go underwater and you watch the whale. But you can watch the whale behavior and just watch, observe, and learn. But you can also interfere with the whale behavior. You can push them in certain direction. You can isolate the whale. You can isolate a shark and change their behavior. But that's human interference now. That's not nature anymore. That's not Mother Nature in action anymore. So the immune system, we can interfere with chemotherapy, radiation, antibiotic, taking certain synthetic produced vitamin. That is not the vitamin that come from nature. We can interfere as human beings in so many ways. In many ways, sometimes it's good, and in other ways, what we think we're doing, it might not be good. So we have to be cautious as we interfere with the universe, that we are interfering maybe to help the universe continue to do what it wants to do as nature had determined it to do, or should we interfere in a way that we can be detrimental to that immune system? And that's where the balance needs to come in as we keep growing and keep learning about the universe. Now, about that universe, the immune system. Now, the question is, why do we know so little about this universe? If we know so much about the other universe out there with the stars and the planets and all these things, why we know so little about this one?
Why?
Because you have a government that lives as a business, is run as a business. Our government is run like a business. It has a budget, and the money comes from somewhere, and you have pharmaceutical company. There's another business. Now, those pharmaceutical company, they have to go ahead and make money at the end of the day, or they're going to fire the CEO. It's going to, they're going to go out. So that pharmaceutical company, they have to make money. And the government and the pharmaceutical company and the hospital, they need each other. They all need each other. So it becomes like a mafia. So this mafia will make sure that one supports the other one. So to give you an example, if you go to a primary care doctor in the community, the government will give X amount of money to that doctor for the care they have rendered to you. If you go to the hospital, to a hospital physician, for the same care, they get paid 3 or 4 times more money than a doctor that is outside. So who becomes richer by taking care of 100 patients? a hospital-based doctor more than a community-based doctor because they're getting paid less money. If you go to a pharmacy, that they, by the way, make a lot of money, but if you go to a pharmacy, they can mark up Tylenol up to a certain level, and that's it. That's their profit. They still make some money. They make a lot more money from other drugs, but they can mark up Tylenol. It's a business. Pharmacy is a business. So if you buy Tylenol at 1 penny a tablet and you sell it at $5 a tablet, you're making a huge markup, which is great. But why the same government allow a pharmacy to take the same pill that because they buy a large quantity, maybe more than a pharmacy, and they can sell it now for $125 because you gave a pill of Tylenol to a patient because he was having a headache, and now you're going to charge $125 from the insurance? That's ridiculous.
Yep.
I mean, it's the same Tylenol. Why are you going to pay that much money?
Because it's a business. It's what you just said.
It's a huge business.
Because they don't see
mafia.
it. Right. They
so,
see
you know,
it.
I mean, you know, you hear all those hypocrites in the White House and in Washington, D.C., and they talking about, oh, we have to cut on the budget and we have to save money. So we're going to look at the insurance and we're going to look at Medicare. If you really want to save money from Medicare, look what you're spending. Who you giving the money to?
You're absolutely right.
You know, you're giving it to all these
insurance companies you're very right. It's really very hard. But so you're saying if they would do research on the immune system,
if you take some of that money and say, you know, if we can do research on the immune system,
yes,
you know, let's spend more of, you know, some of our budget. Let's put some of our budget in the immune system, and let's look at that. You know, let's look at platelet in a person being reinfused back into that person. What is the truth and what is false about that kind of therapy, so that we can enlighten not only the providers but the consumer, the patient, so that they know if I'm going to go for platelet transfusion to enhance my face instead of having a facelift, and we see how well it works, and say, okay, we support that kind of treatment. It works very well. If we're going to do it for MS or Lou Gehrig disease, and we see it doesn't work, then we say, well, you know, really it doesn't work in this disease, but it does work in other kind of conditions where platelet can be used. Now, platelet have been used for people that are losing their hair with alopecia, and apparently with very good results. And I saw a friend of mine that he does the treatment in New York, and he came down to Florida and said, you know, give me somebody, I'm going to show you what we call the vampire facelift. I said, okay. So I asked one of my nurses, you know, do you want to have the vampire facelift?
A vampire? Is that what you said, vampire?
Because it's blood. It's blood.
Oh, all right.
So, you know, she came and she volunteered. He took her blood and he spun the blood, and then he took the platelet out of that blood and put it, of course, you have to activate it with calcium. So you activate the platelet and you re-inject it on the face. And it's like, and I do a lot of aesthetic. So the result that I was watching, I said, wow, this is fabulous. This is great. So I keep track of my nurse. I keep looking at her picture, and she's on Facebook with me. So every time she posts something on Facebook, I magnify and look at her face and say, wow, she looks great.
So it keeps getting better?
It keeps getting better. So, and that is done with her own platelet. So not foreign injection is going in. And so I have a patient of mine that called me and said, you know, look, you know, I've been coming to you for my hair loss, and I was responding to your treatment. We were doing some vitamins and stuff, and she was responding. And then she lost, because of the stress and what have you, she now lost a lot of hair. And she sent me a picture and said, look how I look. So I called this guy. I said, do you think we can, I want to match you guy. I want to see if we can treat her, see what happens. So you get people in that situation that we don't have any kind of support to say, let me tap on this money to take patients like this. I have a few patients with lung cancer. We're just talking about lung cancer. And I have a few patients with lung cancer that I have 3 patients right now with lung cancer that they will do nothing. They want no radiation, no chemotherapy. But they want to go with anything natural that can be done just to let's run the course. And we have heard of people that have cancer. They did something. They went to Peru or they went someplace and they came back and say, I'm cancer free. We don't tap on that. We say, well, let's investigate it. Let's see how that happened.
But no. What you hear is that what was a wrong diagnosis.
Exactly.
Oh, we always hear that, right?
Yeah,
there's something they don't ever admit that it just is. Maybe it is the immune system. What you were saying.
Exactly, and we don't know. We actually don't know. A lot of times we just tell people, if they have lung cancer, they just throw the towel. It's time for you to die.
To throw the towel.
And I have.
Before you do that, I have to get. I know people are listening, saying, "I want to go see Dr. Mencia, but I don't know his phone number." Even though you've told me that over and over and over, I have to do this for you.
There's 954.
No, they don't want to hear it from you. 954-489-1345 again. And it's on East Commercial Boulevard. It's 954-489-1345. And the good news is Dr. Mencia, in all his beautiful clothing, is going to go down and be a doctor there all day today. Saturday, they are open. And if any of you really need home visits, you can call their office because they also care about homebound patients. And that's not a common thing. And we're very happy that he does that. All right. I want to go back to the immune system because when someone comes into as a patient, they come in, they don't feel well. What do you have to do to see how their immune system is? Can you look at them? Do you have to do blood work? What do you do?
The combination of all of the above. You have to get, talk to the patient, get a good history. And yesterday I had a new patient that came to see me. And she just walked in because she said, for a month I've been trying to come in. And a friend of mine kept telling me, come and see you. And today I'm driving. I just made that turn and came to see you.
Good.
So she's Medicare, so we don't have to check with insurance, get authorization. She just came right in. And she said, my only problem is blood pressure. I just have, high blood pressure. And I just want to get checked every 3 months, something like that. That's all I need. And from time to time for you to do my blood work. And she's in her 70s. So I said, well, I want to get to know you. Is that okay? And she said, oh, my God, my friends were so right. That's what they say. You get to know the patient, and then. So I sat down. I said, I want to get to know you. Tell me about yourself. Tell me about your medical history. And she's a lady that is very well off. Her husband used to have a huge company that she had inherited, and she kept, running the company. And, compared to her friends, she's still, with the economy going down, she's still doing very well. And so we're talking, and she said, well, I have breast cancer. It was on my left breast. And they removed, I got it removed. Then it came on, not the whole breast, just the portion of the breast, partial mastectomy. Then she had a year or two ago on the right breast. Now her doctor is on Broward by A1A. So she used to go to a primary care doctor that she fired. Because when the cancer came back, she went to University of Miami. Okay, the lady is well off. She can go anywhere she wants to. So she went to the University of Miami. And, she picked from the staff one of the best doctors. And she have already had surgery there in the past, 8 years ago. Now, 2 years ago, when he came back, she went back to where she went before. The University of Miami called the primary care doctor and said, we need you to send us some lab because, your patient is here and it's now our common patient. And we want to see some of the lab because she's going to undergo surgery. She want to get this taken care of right away. We're going to do it today. They refuse to send anything.
Really?
So she got so upset and said, well,
That's against the law, though, isn't it?
Of course,
actually?
But no, you say, no, she have to sign.
Oh, I see.
But,
you just put up a lot of roadblocks.
You can put a roadblock.
Right.
So that's what they did. They put so much roadblock that the doctor at the University of Miami said, the heck with this. Let's just draw blood. Let's take care of this lady. We do our electrocardiogram. We're just going to clear her as if she had no doctor. We treat her like that. So she went back, and the office manager said, I am not your secretary for you to be calling and having people call to, I am.
Whoa.
That was her response.
Whoa.
According to the patient, that was the response she got. Then she went inside to see the doctor, and the doctor is all upset because he worked with a group of doctors that are affiliated to a hospital. We won't say the name. It's in Broward County, so this hospital that has a lot of doctors affiliated to. So the doctor got upset because why would you go to a surgeon at the University of Miami when I can put you with one of my surgeons here?
You're right.
And she said, because
she has the right to do what she wants,
I'm a free woman and I have the right to do as I want.
Exactly.
And it's my breast, not your breast.
That's beautiful. But see, she had a lot of power there. Then she had you supporting her, and I think we're running out of time.
So she was telling her friend, and she said, her friend said, I've been telling you, go and see Dr. Mencia. He'll send you to the moon if the moon is where you're going to find the right person.
We did it again, and it's every time you come here, we all learn little tidbits about something, so you want to keep your immune system up. But I think with Dr. Mencia, just paraphrasing it, you have to keep your spirit up. You keep your health up, you keep your spirit up, and go to Dr. Mencia for an excellent physician. And that's what I've been saying for years. And there
is nothing wrong with crying, but you have to smile after you cry.
Yeah, I love that. Cry but smile, right? Oh, boy, I love it. So remember, 954-489-1345 is the Adult and Geriatric Medical Center. You can listen here every Saturday morning from 7 to 7:30. And we certainly thank you for coming in looking like a movie star.
Oh, my pleasure.
And we will be back after commercial. We're going to come back with Dr. Mike Hughes with Second Opinions. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.